from a marketing point of view, how did you start with Shockwave? Do you use Google Ads?
Well, no, I don't. I've never used Google Ads. How did I start? Back in the day, I had a fair reputation for dealing with these sorts of problems, and a few of the osteopaths that I used to work with in other clinics knew that I liked them, and I just, so I've got this machine, seems to do wonders for this, that, and the other. So they sent me a few of those, and then I suppose in a 20-mile radius, I've now become, the go-to clinic for that sort of stuff. But a bit of Facebook ad stuff occasionally, really optimizing your website, and ultimately it's in room. Getting it across to the patient that if you've got a chronic problem lasting more than 3 months and you've tried, and now I have the advantage of seeing lots of patients which failed other interventions, and they've come to me with an expectation that I'm the person to deal with these difficult problems. And then it's up to me to educate them to say, look, this is a decision that I think you should make based upon the evidence. Your choice is now. You've done the physio, you've done the exercises. There's not much left. Yes, there's a steroid injection, but most people don't want to do those anymore. Risk of rupture. There's a Shockwave machine that can help with your pain relief and start to supercharge your tissues a little bit. There isn't much else. So you have to do the job in the room and educate patients that are about to make a decision about the cost of their treatment, which is a bit more, but actually...
So it's more expensive having Shockwave?
Yeah, it is.
So they're having less sessions of other things? By what proportion more, out of interest?
That's a difficult thing, because I'm not in the classic mould of seeing patients. If I see a patient more than 3 or 4 times, that's unusual, because I tend to be in and out and give them what they need to do. But Shockwave's 3 to 6 sessions. And I double my charge in effect. My fee is £58. It's slightly less now. £58 to see me and £95 for the Shockwave, the additional. So I do scans as well, and I just uplift and say to patients, look, I think this would benefit you. We can charge a bit more because the machines are costly and I have to service them, and patients understand that. Or customers understand.
And how long is a session of Shockwave therapy? As in an individual?
The actual mechanics of it?
Yeah.
5 minutes.
Just 5 minutes?
Yeah.
Wow.
Yeah.
And did they get other treatment at that same time?
Yeah, as I said, the whole point would be that I always have half an hour, right, and that it will last usually half an hour, I would say,
right,
because it's the whiteboard, the education, how the exercise is going this week, touching base with maybe the diet's changed, have you seen your doctor? It's all of that around the 5 minutes. There are some cases where I've 4 sessions in, we've done most of that, and it might be a 15-minute treatment. Okay. I always stick to half an hour. There are lots of people that chop their sessions down by half and charge the same amount.
Right.
I don't really get that. I don't think that's good value care. Right. But anyway, that's up to them, isn't it?
Okay, and I've got a question from Sandra. Actually, I've got one from Louise White, actually. It says here, if you were spending up to £30,000 on a machine, actually, it goes to what I've just said, actually, about what you're charging per treatment. I mean, you've got to work that out if you're investing £30,000 somehow. I get asked that a lot, and that's fair. It's a lot of money. That's the expensive one. So focused Shockwave is proper lithotripsy, or proper Shockwave, as we would say. That's the expensive stuff. Hardly anyone has got that. That's a bit extra. Most people have got radial pressure wave. Right.
Still called Shockwave, but it's not quite Shockwave. But that's somewhere between. I don't want to get into prices, but let's say it's somewhere between £7,000 and £11,000. Right. That's usually quite an easy buy-in for most clinics starting out on this journey.
But going back to what we said earlier about Google searches or putting it on your website, do you think it's, what can I say? I mean, the branding, the Shockwave name, do you think that pulls people in anyway, just because of having something there? Yeah,
a little bit of USP. And now I would say, because we do some Google stuff sometimes to see what's going, and it's a searchable term. It's way more popular than it was 10 years ago when I started this. It was very fringe. Now patients are aware. They go online and, there'll be all sorts of things about Shockwave treating your tendons. So patients come now much more to us and go, I understand you do this and I want this.
So they're pretty sold on it before they arrive?
Yeah, absolutely. Yeah, the marketplace is now awash with clinics with it. So there's just more out there on Google.
Right.
And paying for it, going back to that question, because that's important, is that when we teach this, we really important to say this, look, you've got to be a tendon-based clinic. Set yourself up as a tendon specialist. And so my physio and other people that work with me in clinic, I see them 3 to 6 times, but then they might see my colleague physio 3 or 4 times on the back of that for the specialist rehab. We've got a treadmill, we do gait analysis, so it builds not just the people you see with the machine at the end of the machine, it builds a whole network of patients that come to see you as a specialism. Okay. That's where it really gets paid
for. How do you deal with the feedback? Can't say the feedback, but you've got a patient coming in, you ask them how they're doing, I guess. Is that the normal way? Yeah. How would you kind of measure improvement? How do you actually gauge whether it's working and it's hitting the spot?
There are some well researched aids to measurement, like the foot function index. So there are some things, literally how many steps a day. So for instance, a patient I saw today with tibialis posterior tendinopathy, So I treated her 3 times, and you make in my clinical notes for those, you would say that what's your walking distance? 250 steps roughly, and standing time, because that's a real biggie with that condition. I can only stand for literally a minute or 2. And she's come in today, and she's now standing for over 15 minutes. And actually, what causes her to sit down is her back, not her ankle.
Okay.
And she's now walking, I remember, up to a mile. She's fine.
Okay.
So there are those general metrics we should use with anyone, really.
Okay, could it shift then? So it's interesting what you said about it going from, what was tendonitis to her back. I mean, how does that connect with you in terms of one thing shifting onto another?
Well, that would be part of my normal, that's always there in the background. I can kind of get with that. But one of the things that I think when you become confident in dealing with tendon problems is saying to patients, look, your pain, rather like back pain, is not at all correlated with the chances of you doing damage. It just isn't. So giving patients the confidence that says, in scanning helps. You scan and say, there's no tears here. It's just a grumpy, sensitive tendon. And actually, if we compare you with somebody who avoids all exercise that causes discomfort, so this person just waits for it to go away, and the person that exercises with tendons, this person come back in a year, does way better than the person that avoids all pain. And you give them that confidence, and that's probably more a useful intervention to stop them getting knock-on effects elsewhere.